Hey there, future nurses, it's Kristine from Nurse in the Making, and today we're going to talk about hypertension. Before we dive in, don't forget to subscribe to my YouTube channel for weekly videos, daily nursing school questions, and all things to help you pass nursing school. Today we're going to talk about hypertension, commonly known as high blood pressure. If you break apart the word, hyper means high, and tension means the force on the vessels which causes them to stretch. Okay, let's talk about the pathophysiology of hypertension. This starts in the blood vessels. When the vessels in our body carry blood, our body functions best when the pressure within them is high enough to perfuse the body, but low enough to avoid stressing the vascular system. Blood pressure consists of two numbers, a systolic number and a diastolic number. The systolic number is the pressure put on the vessels when the heart is contracting or squeezing blood out. You can remember this by the memory trick systolic think squeeze. While the diastolic pressure is the pressure put on the vessels when the heart fills with blood. The heart is resting and filling with blood. If you look at the number, systolic is on top and diastolic is on the bottom. Systolic should always be higher than diastolic. If you think about it, it makes the most sense because systolic think squeeze. There is an active pushing on the vessels, and diastolic, the heart is resting and refilling. Think about a high pressure fire hydrant connected to a garden hose. There is so much resistance. So, hypertension is an elevated level of either systolic or diastolic blood pressure. There are some values you need to be aware of when talking about hypertension. Hypertension is defined as a systolic above 120 and a diastolic above 80. Here's a chart to help you remember this. Now note that every patient has their own normal blood pressure. This is just a guideline to help you remember these. Normal is 120 over 80. Pre-hypertension is 120 to 129 over 80 to 89. Stage 1 hypertension is 140 to 159 over 90 to 99. Stage 2 hypertension is anything greater than 160 or anything greater than 100. And a hypertensive crisis, which is a medical emergency, is defined as anything over 180 or anything over 120. Let's talk about some risk factors of hypertension. Some people are genetically predisposed to high blood pressure, so be sure to ask if it runs in the family. This is a non-modifiable factor, meaning they can't change their family history. Some modifiable risk factors, meaning things that the patient can modify or change in their life, such as smoking, high salt intake, anxiety, high stress levels, obesity, diabetes, and other chronic illnesses. Let's talk about the signs and symptoms. You may hear hypertension called the silent killer. This is because there might not be any obvious signs and symptoms. Hypertension can be a chronic, lifelong issue for many people. The main indicator of hypertension is an elevated blood pressure reading. But severe hypertension or huge changes in pressure should be considered an emergency. Some symptoms are dizziness, blurred vision, severe headache, and nausea. These can be a sign of a hypertensive crisis, which can lead to a stroke, an aneurysm, a heart attack, or other long-lasting effects. One of the major ways hypertension is controlled is something called antihypertensive medications. There are many different types of antihypertensives, but they all do the same thing, which is to bring blood pressure down. They're as easy as A, B, C, D. ACE inhibitors and ARBs, beta blockers, calcium channel blockers, and digoxin and diuretics. This is a huge NCLEX tip. You should educate your patients to take these as directed. Missing doses can lead to an unsafe spike in blood pressure, which is called rebound hypertension. I'm going to do a full video on the different types of antihypertensives, so be sure to subscribe to my channel and ring the bell to be notified when that comes out. When we talk about treatment, we also look at lifestyle changes. As I mentioned before, smoking, high sodium diets, obesity, diabetes, and high stress can all increase a patient's blood pressure. So we encourage our patients to decrease their salt intake or follow a heart-healthy diet. We encourage them to increase their exercise, to stop smoking, and to manage their stress levels. Hypertensive crisis is managed a little bit differently. This is because, just like the name says, it's a crisis. It's an emergency. It needs immediate intervention. A systolic number above 180 or a diastolic number above 120 will put major stress on the vessels and can lead to a heart attack or a stroke. Again, a patient complaining of blurred vision, dizziness, nausea, or very commonly a pounding headache must be assessed right away. IV antihypertensives will be given for treatment as they act quickly and effectively to lower the blood pressure in those vessels. Let's talk about some nursing considerations. A manual blood pressure is best. Machines are helpful, but they can be inaccurate. So think of this memory trick. Manual is the most accurate, and electronics can have errors. The NCLEX loves to ask questions on this. You should place the cuff over the brachial artery and place your stethoscope on the antecubital region inside the elbow. Educate the patient not to smoke or exercise within 30 minutes of having their blood pressure checked. This can cause falsely elevated blood pressure levels. The cuff should be at heart level. The arm should be supported. The upper arm should be bare, meaning you should not take a blood pressure over a big bulky sweatshirt. The patient should not cross their legs. The feet should be flat on the floor, and the back should be supported. You should not take blood pressure in arms with a history of a mastectomy, an arm with an AV shunt, blood clots, or an arm with PICC lines or central lines. It's very important that you choose the correct cuff size. Too tight or too small, the pressure may be falsely elevated. You can remember this by the memory trick. If the cuff is too small, the numbers are too tall, meaning it will be falsely elevated. Too loose and the pressure will be falsely low reading. You can remember this by the memory trick large cuff, think low numbers. If you found this video helpful, don't forget to subscribe to my YouTube channel. Happy studying, future nurses!